Dr. Richard Hoffman has been asked to put a face on RSD. He will be moderating a panel of adolescent and teenage RSD patients. A panel comprised of their parents will follow. Both the interviews with the children and their parents represent the unscripted and unedited responses to the interviewer's questions and comments. These interviews were designed for the treating physician who is often too busy with practice demands to have an opportunity to fully experience the impact of this disease on the lives of patients.
I'm Dr. Richard Hoffman. I'm a clinical psychologist, and I work primarily in the emotional effects of physical illnesses and injuries. Today we're going to speak about reflex sympathetic nerve dystrophy and learn more about what it's like for the people suffering with that illness. We're going to begin with introducing the people on the panel with me today, beginning to my right with Justin.
I'm Justin. I'm 15, and I'm from Lakeland, Florida.
I'm Sarah. I'm from Pinellas Park, and I'm 18.
I'm Lacey. I'm 11, and I'm from Tallahassee.
I'm Amanda. I'm 15 and from Plant City, Florida.
Very good. I thought what we'd begin with is talking about what you think people should know about this illness, particularly what children should know, children who have had this diagnosis. What do you think is good for them to know about what it's been like and what it has meant to you? Any thoughts about that?
It's hard to go on day by day.
Hard in what way?
Just doing the stuff that you can't normally do.
Meaning you can't do the things that you were doing before?
Yeah, you can't play sports, you can't run, you can't be a normal teenager.
Okay, it made life a lot different for you. Okay. Justin, what do you think people should know about what the diagnosis does and how it affects you?
You can't really you can't do any of the stuff that you used to do. It's hard to get up in the mornings and get started on the day.
Makes everything more effortful. Nothing can just be done naturally. Everything has to be an effort.
Yeah.
Okay. Lacey, do you have any thoughts about it?
When my friends used to go outside and play at school, I couldn't go out, you know.
Yeah.
All I could do is sit there and watch them.
Sure.
And sometimes it really felt left out, you know.
Can really feel left out. Amanda?
I'd have to agree with everybody else. It's hard waking up every morning and going on with your day and not being able to do things you really enjoyed before you had it. And it's hard not being able to participate in things you would like to participate in.
Sure. What do you think would be particularly important in doing this tape to let people know? You think that doing a tape like this would be worthwhile?
Yes, most definitely.
What particularly makes it important to let people know, about what's important about letting people know what the experience has been like?
So they have a better understanding, and you know, we're not constantly being told that it's all in our head, and people that don't understand it may understand it a little better.
Okay. Some folks have just thought that it was imaginary or that you didn't really have anything wrong with you?
Yeah, like some kids that I go to school with, I know they say I fake it, or, you know, there's nothing really wrong with you, because they don't understand the full.
They think if you have both your arms and your legs, there can't be anything wrong with you?
Yeah.
And there's not any blood coming out of your ears, that you haven't had a problem. Any other thoughts about why doing a tape like this would be worthwhile? Remember you said there was a sense of feeling alone and lonely. Maybe that would be an important thing. If somebody watching the tape had RSD and was feeling that way, do you think that might be helpful to them to feel like they weren't alone? Yeah. Let me go back now and ask you, how did all this get started? What happened that originally triggered the symptoms? Anybody want to tell us about that?
I was a gymnast for 12 years, and I had numerous falls and bumps and bruises, and that's how mine started.
One day you had a bump or a bruise that didn't get better?
No, I had a sprained wrist and then a sprained ankle.
And after you sprained your wrist and your ankle, in the past, what would usually happen?
It would just throb and it would hurt really bad, but I mean, I kept on. I didn't really think anything of it.
And then in the past, it would gradually get better, but this time it didn't?
No, it got worse.
This time it got worse. And you were waiting and waiting because, you know, people, the way people do things is what they've experienced in the past is what they expect for the future. So you were waiting and waiting for it to start to get better, and it just didn't.
Mm-hmm.
Anyone else want to tell us about what it was like, how the symptoms first got triggered?
I got hit by playing softball. And I wore a bruise in the outline of the softball.
Got hit by the ball?
For like 3 months straight. And doctors put me into therapy. And I was on crutches for days.
Where did you get hit?
Right above my knee.
Okay. Did you ever have anything like that before?
I got hit once before, but
The
the bruise went away. And
so when it happened, it wasn't like you really thought, this is really very different than anything else that's ever happened to me. It wasn't like I was in a car accident and pow, another car slammed into us, and right away I knew I was seriously injured. What happened for you was like what happened with Amanda, that it seemed like a regular injury, things you had had before,
Yep.
except this time, one day went into the next and it didn't get better the way it had in the past. Is that what it's been like for you guys also? Justin, you're shaking your head. What was it like for you?
I broke my ankle, and I was in a hospital for a week straight, and they didn't know what was wrong. And they kept saying that it was all in my head, I wasn't hurting. And I finally got help.
Okay, so that one of the other themes is that lots of times even the doctors who see you at first aren't sure what's wrong with you, and they don't really understand why you're having the pain. Now, had you ever broken any bones before, or this was an athletic injury?
Yeah, I had broken my ankles before, but it had always gotten better.
It got better. And this time you go in the hospital, it's not getting better, and not only are you hurting, but people are telling you they don't know what's wrong, and this phrase, it's all in your head, comes up again. Boy, that must really be annoying. I can imagine if you're sitting there hurting and somebody is telling you that they don't really think you're hurt. That can be pretty devastating. And Lacey, what about you?
I was gymnastics too. I sprained my ankle and I kept spraining it over and over again. And then one time it just didn't get better.
One time it just didn't get better. Now, one of the things you started to talk about, each of you started to talk about, is that it wasn't easy for the doctors to diagnose it. It sounds like something where you had to see a lot of different doctors. You've had other illnesses or injuries before, and you go to the doctor, he examines you, tells you what's wrong, gives you some treatment, and you go home, you take the medicine, or you rest, or go to a specialist that he recommends, and he gives you some medicine or some treatment, and it gets better. But this time it really sounds different. It sounds like there was some question about whether there was something really wrong with you, and it sounded like you had to see a lot of different doctors. Is that what happened? You want to tell us? I think that might be useful for people to hear also. Can you tell us about what that experience was like and how how the diagnosis gradually came about?
It was horrible. I mean, I couldn't walk. I was on crutches. I was in a wheelchair. And I went to tons of doctors. I mean, and it just went from one day to one doctor and another day to a different doctor, and it just would not stop. And finally, I went to, I think it was Dr. Morris, and he referred us to Dr. Kirkpatrick, and then he knew right away.
Okay. What kind of feelings were you having when that was going on, going from doctor to doctor and nobody being sure of what was wrong?
I was suicidal.
Really feeling really sad, hopeless? That must have been really hard. Just felt like it was futile, that there's no answer.
I went to therapy, and it kind of made me feel like I was kind of crazy, but I knew I wasn't. But I was like really suicidal.
Okay. It was just feelings of despair, like the whole thing is hopeless.
And so I thought, why should I even be living if nobody can help me?
Okay. And it was the hopelessness that was so painful, that there was no hope for you. Okay. How about you other guys? Was it hard to get it diagnosed? What happened?
I know that every time I'd go to another doctor and they would have this, the same answer that I was getting from the previous doctor, nothing was really making sense to me, and I felt the same way Sarah did, and I felt that, well, if nobody's going to be able to find what's wrong with me, then what's the point in even, living if I'm going to live my day-to-day life going to different doctors and getting the same answer and not getting anywhere.
So again, it was a sense of hopelessness and almost despair that I keep going to doctors and we don't get anywhere. Okay. So there's despair, and it also sounds like you were kind of confused, like what's going on here?
And to be so young and have this happen, it's hard.
Well, that's another kind of interesting thing, isn't it? When you're a kid, you haven't had that many experiences in life. Now, most things like this, painful experiences, RSD, significant losses, difficult parts of life, happen to adults, and they're very difficult too. But for adults, they've had more experiences in life, so they can kind of get inoculated. They have more perspective. Inoculated is kind of a fancy word, meaning, they have something, an injection they give you for measles, and they give you a little bit of the measles, and that way you don't get the full measles. That's what they mean by inoculated. By having more experiences in life, it prepares you a little bit more. And even though it's painful and very difficult, when you're a child it must be even more so, because you haven't had other things to give it some perspective to compare it to. So it must be really difficult for a kid. So how did they finally come to the diagnosis?
I went to a child neurologist, and he conducted nerve tests, and finally he pulled my mom and I into the office, and he told us that I had RSD, and he wanted to get a second opinion, and I had a second opinion, and it was confirmed that I had it.
Okay. So finally a neurologist was able to diagnose it.
A child neurologist.
Okay. Give us a general idea. How many doctors had you been to before somebody gave you the diagnosis?
A lot. I don't even think I can count.
More than 2 or 3?
Yes, a lot more than 2 or 3.
Okay. Lacey, did you go to a lot of doctors too before they found out what was wrong?
I have been everywhere.
Everywhere.
To Gainesville, everywhere.
And what were you saying to yourself? What the heck is wrong? Why can't they figure this out?
I started to think that nobody was ever going to believe me?
Okay.
You know?
And that's really a theme that keeps coming up. People aren't believing me. And how does that make you feel when you go to doctors and they don't believe you?
Really, really bad.
Okay. But finally you went to a doctor who gave you the diagnosis?
Actually, it was my therapist.
Your therapist?
She kind of studied the idea and kind of gave us the idea. And then we went to my doctor, the one that I always go to. And he kind of said that he had thought about that too. And they sent me to Dr. Kirkpatrick, and he said that, yes, I had RSD.
Okay. And Justin, for you it was that way also?
Yeah, I had been to many doctors also. And one of the nights that I was in the emergency room, they had called down another doctor, and he said that I had signs of RSD.
Okay.
And then my mom, she started looking it up on the computer, and I started going to even more doctors, and a lot of doctors didn't know about it.
So this must be a hard diagnosis to make.
Yeah.
Did any of you ever hear about RSD or hear those letters before? So when they said, we think you have RSD, did it mean anything to you?
Not
really
really.
didn't. Okay. Was it frightening? You have a diagnosis you never heard of? What? Finally, after all this time, 2, 3, 7, 8, 10, maybe 12 doctors for some of you, finally you get a diagnosis and you have no idea what the terms mean, never heard of this illness before. Was that frightening, or what feeling did you have about it?
I was really scared. Didn't know what to expect.
And confused?
Yes. Didn't understand.
Okay. Okay. So you have a whole lot of feelings, fear and confusion and despair. Let me ask you, did any of you feel angry that this happened to you?
Yes.
Like, why me? What do you do with those feelings? Do they just sort of churn around inside you and you get irritable? And
I know my friends kind of held me up, and they would
having
talk
friends
to
is
me
important then.
and help me a lot.
Sure. Okay. So now we've got the diagnosis. So what happens? You got a diagnosis. What do they do?
You start treatment. That's what
Okay.
I did. I started treatment right away.
What does that mean? What was the treatment?
I went and I got spinal blocks done, and that started helping me walk, and I started walking again. And then I did a whole bunch of them.
Okay. Beside the blocks, did you have any other treatments? Did they give you any kind of medication?
Dr. Kirkpatrick gave me Neurontin,
Okay.
and
What was it supposed to do? Why did he give it to you?
from what I understand, it's supposed to, whenever I get pain, just I take it and it'll relieve the edge. It'll take the edge off,
So he gave it to you for the pain to help.
so I can tolerate it.
Okay. Did it do anything?
It did until it got in my system, and now it don't work.
Okay, so it worked for a while, and now it's not working anymore. Now, I'm not sure, but Justin, did you try Neurontin also?
Yeah, I was on the rotten, but it didn't help at all.
Didn't help. And did either of you have any side effects from the Neurontin?
I was just sleepy.
Okay, so we're not sure whether they had given you a large enough dose. We know they didn't give you too much because you would have started to get side effects, but, and you know, I'm just wondering about the possibility that they could have perhaps tried a larger dose, but that's something I guess the doctors will think about if they think it's appropriate for you. Any other medications that you've had?
Right now I'm on the clonidine patches,
Okay. For
the pain,
When-
to kind of dull the pain.
when it gets really acute, when it gets really intense?
No, actually, right now, and I have it in my spine, and it's a constant, so I constantly have the patches on there.
And the patches help?
Yes, they help a great deal.
Let me ask you a kind of an interesting question. You feel better with the patches. Did you ever try, after you started with the patches, taking the patches off?
Yes, actually yesterday I just put 2 new ones on after having them off for about 3 weeks.
What was it like while they were off?
The past 2 weeks it was painful.
Okay. Has that happened before, where you went through cycles where you had the patch on for a while, it helped, then you took the patch off for a period of time and the symptoms came back, and then you put the patch on and it was helpful, and you took the patch off at a point later? In other words, have you gone with it, without it, with it, without it, and you find there's a kind of a consistent theme that it does get better when the patch is on, and then when the patch is off it comes back?
It slowly comes. I mean, it's not like it comes back automatically, but after about a week it comes back.
Okay. That would tell us that it's not in your head. If there's this really consistent effect, it really suggests that this isn't imaginary, because I keep showing over and over again that when the patch is on I get the help. Now, you said it's for pain, but was it any specific, was it particularly for the sensitivity of your skin, or for the RSD itself, or?
I'm pretty sure it's for the RSD, the pain, just to dull it, not so you have the full on pain.
Okay. And is it for any particular part of your body that seems to be more affected?
Yes, the part that you're having the most pain with the RSD.
Okay. Now, the other thing I was wondering about, pain often makes it very difficult for people to sleep. Have any of you had any kind of medication that was designed to help you sleep?
I did. I took Ambien.
And that helped?
Yeah, but I didn't take it. I only take it when I can't sleep.
Just took it when it was really a big problem. Okay. Justin, you look like you were going to say something.
I think I took Ambien too.
Was it Ambien or Elavil?
I don't think it was
I
Elavil.
don't think so. Okay. Okay. But did that help you?
It helped me sleep a lot.
Helped you with sleeping a lot. Okay. All right. Any other treatments that you've had? Yes.
I've had amitriptyline.
Ah. And why did they give you that? Do you know?
For sleep.
For sleep. Did that help you? Well, what was it like when you were having trouble sleep? Did you fall asleep and wake up and fall asleep and wake up, or you just couldn't fall asleep at night?
It would be like I couldn't fall asleep, so I'd get up and ask for, like Tylenol or anything just to help it.
Okay.
And then I would go back, and then I'd get back up and say, I just can't fall asleep.
And your mom would give you the amitriptyline?
She would do whatever she could.
That's your mom.
We tried heat pads, ice pads, like
okay.
everything.
Everything. And the amitriptyline helped you. Now, one of the things I was curious about, I know that some of the procedures can be painful. Did they give you any medication to go along with the procedures to help with the pain of the procedure or the effect of the procedure? No.
I'm not awake during my block, so.
Sometimes I've talked to some of the physicians, and sometimes they will give you something for brief periods after you've had the procedure to control the pain. If you've had a block or some other procedure that's particularly difficult, they'll give you something to try to, just for a short period of time, just to control the pain from the procedure itself. Have any of you had anything like that?
I know when I had the sympathectomy on my upper, I know that they gave me morphine.
Just to get through that. And that helped?
No, it didn't.
Didn't help?
It made me sick.
Okay. Okay. So that wasn't a good experience for you?
Not at all.
Okay. I guess the idea, though, is that they're thinking that they can give you something like morphine for a short period of time to help with the pain without it being a problem. Okay. Any other medications?
When I was in the hospital with a 5-day migraine, I take Medrin. Every time I get a headache, I take Medrin.
Okay. And that worked for you? All right. Lacey, were you going to say something? You look so pensive.
I've tried lots of stuff,
Okay.
but sometimes they did exactly the opposite of what they were supposed to do.
It did?
There was one that was supposed to help me sleep, but it kept me up till 12,
Okay.
and then I fell asleep and woke me up at 1.
Okay. And that's one of the reasons that it's important to have close contact with your doctor so he can monitor those medications. But let's go back to some important psychosocial issues for a minute. What I'd really like to talk about for a while is how it's affecting your life every day, how it affects your family, school, participating in sports, your social activities, dating, friends. And you know, the thing I think about a lot is fitting in. It must be hard to feel like I fit in, and I know when you're just about to become a teenager and when you are a teenager, fitting in is really important. How do those kinds of things, how do those things get affected by the illness?
Well, most every time I've been on crutches,
Mm-hmm.
somebody else in my class has been on crutches too.
Uh-huh.
You know, so we would kind of hang out together.
Bond, yeah.
Like me and my best friend, we were on crutches this last time that I was on crutches. And then the time before, my friend was on crutches too, so.
Okay. Anybody else?
It's hard. I mean, 'cause my boyfriend doesn't understand what I go through.
Okay.
So it's hard for him to understand that I'm like really tired. I can't just get up and go because I get tired so easily.
Okay.
So he doesn't understand, and it's hard for my parents because they want me to do stuff around the house, and it's like I don't have any energy to do anything.
Sure. And it makes you feel distant from them, like they don't understand, like I'm on a different planet from them.
Yeah.
Okay. Okay. How about in your day-to-day life? Do you think it's affected the nature of the friendships you have?
I don't think it's affected them. If anything, my friends are very supportive. I think the biggest thing is the kids that I go to school with that don't understand. And it's hard because you wake up every morning and you don't know what to do with yourself because you know you have to get up and you have to go to school because you need your education, but it's so hard going through the day with school and just because there's constant bumping and it was hard.
So it's not only being emotionally close to people, there's a sense of I'm afraid to be physically too close because if I bump into anybody, it's more pain.
And you can develop wherever you get bumped at too, because I mean it spreads. So if you have it on like your right arm and you get hit on your left arm, I mean you constantly think, are you going to have it in your left arm too?
Okay.
So
you have to be vigilant and you're constantly worried and concerned about things that teenagers shouldn't have to be concerned about. Okay. Let me ask you, how about sports though? Justin, you look like a guy who's been involved in sports. In fact, were you involved with sports before?
I had played baseball for 10 years in a row.
10 years?
And then I had broken my ankle and I got this disease and I never played since.
Have not played any sports since. Boy, that must be rough. And the other guys are out there still playing. The guys that you grew up with playing in Little League, they're trying out for the high school team and playing winter ball and stuff like that, and you're watching them.
Yeah.
Okay. That's a difficult experience, I'm sure. Does it affect your goals for the future? Your plans? How about that?
for me it did, because I always wanted to be a flight attendant ever since I was younger.
Okay.
But I can't
I can't stand for long periods of time because then my feet hurt, my ankle hurts, and I get so tired so easily, so I can't constantly be doing that. And then if I sit for such a long period of time, I just start aching.
Okay.
So it affects my goal for being a flight attendant.
Okay. Hard to make plans for the future because you don't know from week to week and month to month
Very
how bad
hard.
the symptoms are going to be. Okay. Amanda, how about for you? How is it?
It affected me because I planned on going to college on a full gymnast scholarship, and I lost that, and it was hard.
Okay.
Couldn't go to college and be the gymnast that I wanted to be and go to the Olympics. And
Lots of your dreams you don't see happening anymore.
Oh.
That's painful, sure. It's as though I just have to live one day at a time, and I can't think too far into the future because I just don't know what will be. Okay. Let me ask you kind of a related question. From what you've been saying about all these different things, do you think that what happened was when I got RSD, it made me grow up too fast? I didn't get a chance to be a kid?
Nope.
Okay.
It hasn't really changed anything I've done except for the time when it really hurts. Because,
Okay.
you know, I still play basketball with my
You do?
friends, you know, tie up with them and run around, go camping, and all that.
Okay, so for you it hasn't interfered as much. So we have kind of a range where some people have had it really interfere with their making plans, thinking about the future. They can't make plans and do things on more than a day-to-day basis, to other people where it's been more of just a limited inconvenience.
And it's like, but there's some things that they just won't let me do.
Okay.
Like I used to ride horseback,
Uh-huh.
and now my sister rides horseback, and I can't. And I really want to, and my mom told me next year, and then we figured out I had reflex sympathetic dystrophy, and there wasn't any next year.
Okay.
So,
So that part has been hard. Okay. So what we do is we try to get the treatment, do the things the doctors suggest, and hope that there'll be better treatments in the future? Okay. All right. Any other thoughts before we stop this morning? Well, let's go back and just say one thing in terms of where we started. Do you think the idea of having some folks to talk about this with and to share those experiences with has been helpful or would be helpful to you? When you were diagnosed and when you went through all of this, do you think it's, and you're kind of feeling like I'm on another planet from other people, useful to once in a while be around other people who've had that kind of problem so that you don't feel quite as alien or different from other people? You think it makes you feel that you're connected to something?
I think if you have somebody your own age to talk to,
Sure.
it helps.
Okay. Justin, you look like you were going to say something. Do you talk with your friends about it? Do they ask you about it?
A couple of my friends, I talked to them about it.
They try to understand, but it's hard
Yeah.
for them? Sure. Okay. Any other thoughts?
when I go to school, it's like everybody wants to know what's wrong, and I really don't know exactly what to say, you know, because it's hard for them to understand, and you know, I'm not even sure I know exactly what it is, so I don't know how to say it. I say, go ask my mom.
Go ask your mom. That's a reasonable thing to say. You know, the other thing I was thinking when you said that was, is it hard to study when you have this kind of problem and it's distracting you?
No, not really.
You can study okay. Some folks have more trouble with it. They find it hard to concentrate Amanda's shaking her head there.
It's very hard to concentrate.
Wears you down.
Yeah, it's a major wear down.
Yeah. So really, it kind of affects every dimension of your life, but for some people more and some people less, and depends on which dimension you talk about. But it really goes directly through every part of your life. Okay. Well, let me say to you before we close that I really appreciate your candor, and I'm hopeful that other people really hearing at kind of a gut level what this is like is going to be helpful for them. Because I think the things that you all are experiencing are things that they've experienced too. And I really do think it will be helpful for them to know that they're not alone, that this isn't all in their head, and that other people are suffering with this kind of illness too. Okay, very good. I'm Dr. Richard Hoffman. I'm a clinical psychologist, and one of the areas that I practice in is the emotional effects of physical illnesses and injuries. Earlier today, we had the opportunity to speak with some patients, children who have reflex sympathetic nerve dystrophy. It's frequently reported that being a caretaker for a patient is often as difficult or more difficult as being the patient himself. This would be particularly true if the patient were one of your children. We now have the opportunity to speak with some of the parents of children who have reflex sympathetic nerve dystrophy to let them share what the experience of having a child with that problem has been like. I'd like to begin with asking you all what the experience has been like for you in general. What has it meant to you?
It's been an education. A mental, physical, emotional education.
Tell me a little bit more about what you mean by an education.
Learning to think positive and to help your children, regardless of the pain that they may be in, and to be able to still keep a positive mode so that their strength and their desire to continue and to fight the battle is as high as it was day one.
Optimism to keep them being persistent in fighting.
Exactly, exactly. And always look at the positive mode. No, regardless of whether we understand the whys, there's a reason, and it's just not for us to understand right now, but we're gonna know why.
Frustration is bad.
Okay. Tell me, what do you mean by frustration?
By the schools, other doctors, nobody understands it.
Okay.
Like with Justin, you know, we were told that it was in his head.
Sure.
And because doctors just don't know about it. Other people, you mentioned, well, why is your child in a wheelchair? He has RSD. Well, what's that? Okay. You know, nobody understands what it is. And then you have to try to explain it to them. And they still don't understand anymore.
Long, arduous process.
Right, it is. And the school system, it's bad. They don't understand, so yet, you know, so you have a hard time because the children miss a lot of school.
The school system doesn't want to accommodate to the special needs of the kid, of the child, sure.
No, they sure don't.
And that's frustrating on top of the illness itself. That's an interesting area. Tell me, what do you all think the hardest part is?
Juggling everything. You're trying to juggle for them, and in my daughter's case, because she's gone through the teen years, so you're trying to juggle for her to have a normal life, at the same time having the blocks, the pain, the friends who turn out to be not true friends. I mean, life is such a hard balancing act normally for anybody when you go through your teen years and all that. But then you've got one that is in pain 24 hours a day, 7 days a week. And I mean, after the diagnosis, they're still, you know, but getting them from point A to point B, and then getting through that, all the school system, the boyfriends, all that, to point C, and then they're dealing with their anger. You tend to get angry. It's very, as Renee said, it's very frustrating. The whole thing is frustrating. It's a vicious circle.
Okay, so it's like the stress and difficulty of being a teenager then is exacerbated, made worse by this special situation, so you feel like you've got kind of a double whammy.
So it's like their life being pulled out from underneath them.
Okay.
Like with Justin, you know, he was into sports. He can no longer play the sports.
Okay.
And so it's like everything's just pulled out from underneath them, and they're almost set in their own little world because they can't do this, they can't do that. You have to watch them carefully, and
You want to balance watching them with trying to let them have some normal teenage
and it's
activities.
hard.
Sure.
It's really hard.
Which kind of brings up another area, the uncertainty of the illness. It's kind of a mysterious disease that ebbs and flows, and you're never quite certain as to what's going to happen tomorrow. What's that been like?
It's hard. That part's very hard. It's very hard because, like right now, Lacey is doing real well, and so it's hard for me to sit here and listen to everybody else talk about the fact that it does come and go, and that's scary. It's real scary.
So you think things are better, and you think, well, maybe I'm out of the woods for a while, but you're afraid to take a deep breath because the other shoe may drop and it starts all over again.
And you never know when that's going to happen, because with Justin, he was in remission for almost a year.
Well, we had a recurrence too after like 7 months. So.
And it's really hard because now he's back in the wheelchair again after walking and being back to what I call now, normal for him.
Sure.
And to be put right back in the wheelchair.
And it's, I guess, doubly difficult. And when I was introducing the piece, I was saying sometimes it's as hard or harder to be the caretaker because you're watching it. And do you ever have a sense of your own impotence that I wish I could do more?
Oh, yes.
Well, as a mother, you feel like you should be able to put a Band-Aid on it and kiss it and
make it well,
make it better. And I keep telling Lacey, I wish I could put a Band-Aid on it and kiss it, and you can't do that.
When you feel helpless.
It's a helpless feeling for you, and maybe as the mom even more so than for the child, because you want to be there for her. You think that's my role, is to make things better, and and you keep trying, and the amount you can do is so limited.
That's exactly it.
I wish I could do more. And how do you explain to the child that even though I'm doing all I can, it's only accounting for inches in the whole big picture of the illness?
I'm just very open with Amanda and very honest about it. I would cut off my right arm if I knew I could make her better. But I know that's not what's going to do it. But I'm going to be there to support her, and I'm going to be there to help her to make it through the days that we have to have a night of crying just because of the frustration. And I know as a mom you want to do everything you can for your child, but there's some times that you can't. And if you let the child know that you're doing the best you can possibly do with the resources that you have, I think they'll understand, because they've reached that frustration level as a parent. We have reached that frustration level.
So you're kind of saying sometimes you let them know that even though I can't fix it, I'm going to do all I can to share the experience with you, that I'm in it with you.
You have to. You have to in order. It's a team effort.
Okay.
And then in a family situation, it's a family situation where siblings are involved, because then you're talking a whole nother case where brothers and sisters are frustrated because their brother or sister can't do or can't go, and Mom, why are you treating them this way?
Absolutely.
And I can't really relate to that because Amanda's an only child, but I know others.
We go through that with the
That's
boys,
hard.
because they're always used to wrestling and everything, and now with my 16-year-old, he goes to wrestle with Justin, and I tell him, don't touch him, don't do that with him, don't do that. And he just finally says, Mom, why do you always yell at me? I said, you can't do that.
Okay, so it really affects the whole family
It affects
dynamic.
the whole family.
Oh, sure.
Yes, not just the caregiver, it affects the whole family.
But I think my biggest problem is fear. I'm so afraid. if she bangs herself, is it going to be a normal bruise, or is it going to end up turning into RSD? If she's out there playing with the dog and she's trying to run, because she can't run like she used to, but she does this kind of loping thing. And if she's running out with a dog, it's a puppy going to get, and she's going to fall and break her leg. You know, and we just had the other symphyctomy done. So it's like, I'm constantly, I'm afraid. I mean, I'll be perfectly honest, I am afraid of what's going to become from her if she ends up with full body. Because already she's got it in both legs, arm. And I'm scared. I don't know what, what's going to happen for her life. I don't know.
It's a sense of being overwhelmed and not having control.
Oh, yeah.
Let me ask you another thing as you were speaking about it. What about guilt? Do you ever feel any sense of guilt, like maybe I should have done something differently?
Yes.
Oh, yeah.
I was the one that signed the paper for her to be able to play softball.
That's, yeah. I coached baseball, and that's how Justin got it. He broke his ankle playing baseball.
So what do you say to yourself? Do you feel like, could I have known? Should I have known? How could you have known?
Logically, no. Okay, logic says, you're way off base. You would have never been, unless you had a crystal ball and you could look into it.
But there's something in your mind that...
But emotionally in your heart and that mother's instincts that I shouldn't have done this. My job was to protect my child.
Okay. Even though it seems as though everyone we interview says there was really nothing special about the triggering event. Things like that, typically it happened before. There were ordinary childhood bruises and episodes that in the past, a few weeks later, had resolved. The only thing that was different was this time, a few weeks later, it was getting worse. But you still think, well, maybe I shouldn't have let him do that. Maybe I should have taken to him another doctor. Maybe I should have taken him to another doctor more quickly. Maybe I shouldn't have accepted what the doctor said, and I should have gone to another doctor right away.
I was very persistent. I didn't stop, and I can honestly say I don't have any guilt.
Okay.
It's like a divorce. You go through 7 stages, and I think with this is the unforeseen. We had no idea her saying she liked to do gymnastics was going to cause this. Okay. As long as I'm here now and I can support her and take care of her,
absolutely,
that's all she needs. If she wants to be a normal child, and being a normal child means playing volleyball or doing gymnastics and competing, why should you feel guilty? You can't, because if you live with that guilt, the guilt will turn into anger, and then the anger reflects into your children.
Sure. Do you ever worry about whether there's some genetic component that we didn't know about?
I used to wonder, because when Sarah was small, she never could stand anything rough on her skin. She couldn't stand you couldn't sit her in the grass. She would freak. And I wonder, and even to this day, she still will go through the store and she will feel the clothes first before I will be able to purchase it. It's got to have a certain feeling and texture for her. So I don't know if it's, a predisposition or, what it is. It's something in the person's body. I don't know.
But I think if there were any genetic studies done, or if at least if they would start doing those, it may trigger something.
I'm not aware of any genetic study, but I am aware that people feel guilty in spite of that.
I know I don't know of any genetic studies. I mean, my grandmother had Lou Gehrig's disease, and I thought, oh, gee, maybe this is what caused it.
Yeah.
Everything runs through your mind. You don't know.
Absolutely. What about anger? Do you ever get angry that this happened to your child?
Oh, yeah.
Why him? Why her?
Sure. Oh, yeah.
What do you do with that anger?
I pushed out a window.
I turn it into a positive.
I pushed out the front window.
I do. I try to get busy and try to see, Lacey becomes my project for trying to find, things that can work for her, that help her life be a little more normal or a little more comfortable, and I get real busy.
Try to use it to energize you.
Exactly. As a positive, again, to try to find help for other children sooner or later.
Now, you were talking about the family dynamics, which is really intriguing. What do you do in that kind of situation? Now you had said that Justin says, leave me alone, let me do this.
Yes.
But it must be very difficult to balance wanting him to have some normal childhood activities with protecting him, plus balance the extra needs he or she has with the needs that the siblings have.
it's hard. Even though there's just 2 years between the two, the middle one, my 16-year-old will say, well, you can't go do this with us because you might get hurt, or, mom's going to watch you close, and, it's just, he don't want him around. I think mainly because, well, he's his younger brother too, but the thing is, I just watch over him too closely, and I always want to know everything that Justin's doing.
Sure.
And I think a lot of it's fear.
Absolutely. What do the other sibs say? How do the brothers and sisters respond?
Well, my daughter says it stinks whenever Lacey is not doing well. She just says it's absolutely unfair and it stinks because it alters her life by the amount of time that, I have so much more energy that I have to put into Lacey and getting her just to and from school or anywhere. And Annie just kind of I think she feels frustrated and left out, and also very angry that her sister can't play.
Sure.
Well, Jonathan tells me that you just take up for him. You care more about him and all this stuff. So it's like putting you on the guilt trip because you are paying more attention to Justin, and they don't understand.
Sure. Even I would imagine the family finances would be affected by it because there are so many expenses that aren't covered by insurance, and having to take them places, and hotel expenses and travel expenses.
Exactly.
And the other sibs have to deal with. Okay.
Yeah.
What about your own lives? Do you find that your social relationships are different?
My life has become her life.
Ah.
I had to quit my job when she first got sick because my husband was the major breadwinner. So I ended up running her all over the place. And when we finally got the diagnosis, again, I'm the one who ran her to Tampa. And I've run her all over, whether it's to school, pick her up from school, to the mall, to the doctors. I've run her everywhere.
Do you and your husband maintain any of your old social relationships? How do the couples that you interact with respond?
Well, my husband now works in Miami. So the couples that we used to hang out with, they've gone to the wayside because they've got healthy children.
Okay.
They don't have to deal with this. They don't have to worry about,
It's awkward for them when I imagine, when they're talking about so-and-so is playing high school baseball or on the swimming team or going to homecoming. They feel awkward saying those things to you when they know that a child can't do that.
Yeah, because my best friend, her daughter, was also named Sarah, and she played softball, and she was a pitcher. So they'd be going to the softball games, and we could not go to the softball games, and my Sarah wasn't allowed to play softball anymore. So she felt guilty about it. So it basically destroyed our relationship because she couldn't deal with her guilt feelings that her children were healthy.
Okay. And some of the time that happens, some of the time though, some friends have become very close, become almost like part of the family.
Exactly.
It's kind of an interesting thing. Some of them fade away and some of them get closer. Very few, but it does change. It changed the dynamics of it for all of them.
Sure.
Nothing stays
Constantly.
the same.
Well, especially if Lacey's been in a wheelchair several times, and a lot of families aren't equipped at their home to deal with that. So, they can't have her over because maybe, they have stairs or whatever. So it does make it difficult.
Have you been surprised by how helpful some of the couples are, some of the friends are?
Oh, very much so.
It's
They all
interesting.
know the limitations.
Right.
If she's at Busch Gardens or Disney World, they know her limitations, and if she'll be tired and she says, I have to sit, then they know she has to sit. And she knows
Okay.
her limitations.
Well, that's, I'm sure, and very altruistic. But let's talk for a minute about whether friends have been very supportive to you all. Do you find that there are one or two folks who have said to you, I know this must be difficult, I want to help as much as I can, I want to be as good a friend as I can?
I have really good friends, and I think they all want to be that way, but I think it's very difficult for them to understand. It's difficult. I can't even explain it. So, you know, for them to be able to understand what we're going through and the things that we're dealing with, it's almost impossible.
Okay. So some of them just sort of hold back because they just don't know how to make the appropriate expressions, and some of them, one or two of them, are willing to say, look, I don't care if it's awkward, I want to be there for you.
Oh, yeah.
Yeah, sure.
Okay.
This has become my best friend right here.
Okay.
I mean, we have, but with Justin and Sarah, you know, we compare notes and, you know, we email each other back and forth.
Okay.
And,
Well, see, before I met Renee, I thought it was just me. I thought I was doing something wrong. How Sarah would get angry and frustrated and all, and she'd bruise real easy and things like that. And then when I met Renee, we were able to compare horror stories. It's the disease.
Okay. Do you ever let yourself think about the future?
I live from day to day.
Yeah,
I live
I don't
current.
really.
Make each day the best that I can make it for her.
So you try to focus from day to day and
Correct.
not
What the
think too
future
far.
brings, and I'll deal with it when it's here.
Okay. Is that for you also?
with Justin, you know, he's been talking about what he wants to do after he gets out of school and everything.
How do you respond to that? Do you?
Well, what he originally wanted to be, you know, there's just no way he can be a veterinarian.
Mm-hmm.
And so now he says that he wants to be a carpenter. And I said, Justin, you can't be a carpenter. Well, he says, I want to be able to design, you know, buildings and stuff, which to me is an engineer. And which he could very well do that.
Okay.
So, but...
And it's kind of hard to try to be realistic about the future.
Yes.
But also let them have their dreams and goals for the future.
You have to.
And hope, of course, is a very important part in any kind of treatment, giving people hope that there can be better treatments, that there can be cures in the future. So it's kind of like, well, I want to give them a dose of reality. I don't want to make my child a dreamer, but I also don't want to take away a sense of hope for them.
Exactly.
Because if you take that away from them, then they're just going to give up. They have to have that hope that they can, you know, maybe one day be able to go out and dance and, you know, have a good time again, and maybe play baseball again, you know, do gymnastics again, you know, anything that they love to do. Okay. You've got to let them have that hope that they can do it again.
And at the same time focus on today and maximizing what they're able to do today.
Right.
Hour by hour is when we do it.
Yeah.
Okay.
Because Sarah's already she's already gone through that. She started getting sick at 14, and so she's now 18. And those dreams and everything have kind of like already gone to the wayside. She knows it's not going to happen. And I'm not one with her that I will ever tell her, continue to reach for the stars. Because the letdown, each child is different. And I think only each parent can know how to deal with their own child.
That's true.
And some children, if you have them continue to reach for the stars, when they cannot attain that goal, the letdown can be twice as hard.
Okay. And sure, you want them, if they can't do that thing that they're dreaming about, then it just becomes a fantasy. So you want them to have some goals, but also to focus on things that they are able to do today that they can maximize with regard to their current potential.
Right. Correct.
The other thing I was curious about, have there been any particular treatments that seem to have been more or less effective for the kids?
The sympathectomy worked really great with Sarah.
Okay.
Lacey's just had the sympathetic nerve blocks, and as Dr. Kirkpatrick said, you know, she had a series of 3, and she did go into remission after that. Whether or not that was a direct result of the nerve blocks, he's not, you know, there's not really a way to know for sure, but.
Okay. How about some of the supplemental treatments, things like Neurontin, Celebrex, Elavil? Have any of those things been helpful to the kids?
Neurontin hasn't helped Justin at all.
Okay. He didn't get much relief from that.
Yeah, it didn't help Amanda either.
It used to help Sarah, but it doesn't anymore.
Okay.
There wasn't, we didn't find any narcotics. I mean, Lortab was all that Lacey tried, but it was kind of affected the way that her personality and the way that she functioned. But Celebrex has helped her. She says it actually helps her more than a narcotic type of drug.
Oh, that's fantastic.
She also has some amitriptyline does help her sleep.
Okay. Anyone else have any experience with amitriptyline? Or?
Sarah, we haven't put Sarah in anything for sleep, but Sarah does not sleep.
Ah.
Sarah will be up around the clock until she drops.
Okay.
Justin takes the, it's a mild antidepressant.
Probably Elavil.
No, the Desperine or...
Okay. Desipramine?
Starts with a D.
Okay.
I think it's Desperine.
I don't want to guess, but he's been helped by one of the...
He takes that and...
That helps him sleep?
A little bit.
Okay.
He has rough nights with sleep. It seems like nights are our worst time.
Okay. How about the clonidine patches? Have any of you...
That's what Amanda uses.
And that helps?
She swears by them.
Okay.
She has, she's had a double sympathectomy on her right arm and her left leg, but the patches seem to help the pain in her back.
Okay. Do they, in terms of having the procedures themselves can be kind of painful, I think. Have you had any experience with any kind of pain medication to help with just getting through the procedure or the immediate after effects of the procedures?
Well, Sarah's given ketamine when she has the blocks.
Okay.
So she doesn't remember them, which is a blessing.
Yes. That's the same with Justin. He doesn't remember them.
And Dr. Kirkpatrick's great because he lets her pretty much take charge. She tells him where to put the IV. You're not doing it in the right vein. The vein's going to blow. You need to use it. And he lets her go. He lets her tell him how to do it, what Band-Aid to use. And it gives her a little bit of sense of control.
That's probably it.
Having some... Because she needs to have some sense of control.
And he's wonderful with the children. Dr. Kirkpatrick is.
Okay. Having that sense of control, I guess, is particularly important with a disease like this where you often feel that you have no control.
Right.
Okay. Any other thoughts? We're going to stop shortly. Any other thoughts that you would want people listening to the tape to know so they didn't feel quite so isolated or alone? Anything about the experience of having a child with an illness of this sort?
Well, we're proof right here, the four of us. And be there for your children. And listen. And do all you can do.
That's true. I mean, there's got to be some studies done to find out why and where it's coming from, and
and education.
That's it.
Okay.
The schools, the ambulance drivers, the ERs.
Okay. So you want to maximize what they can do today without taking away their hopes and dreams for the future.
Correct.
True.
Realism with a dose of optimism, as you were saying earlier.
Correct.
That's true.
Okay. Very good. I appreciate your candor and your being here today. And hopefully we have provided some information and something for other folks with these kinds of problems to relate to.
I hope so.
Okay. Thank you.
Thank you.
Thank you.
There are several key points to be made from this program. While the patients interviewed varied in sex, age, and severity of symptoms, there are many common threads. Perhaps the most fundamental is the idea that RSD pervades every dimension of the patient's life. In most cases, onset of RSD frequently occurs as a result of some innocuous or seemingly benign accident or event, not unlike accidents that the patient has had without incident at earlier points in his or her life. For example, Amanda thought she had suffered a simple sprain of the wrist. However, this simple sprain of the wrist led to RSD spreading from her right upper extremity to both lower extremities. The diagnosis is difficult, as occurred in all four cases presented. The diagnosis often involves the patient having been seen by multiple specialists, often with consideration of a psychogenic or emotional origin before a conclusive diagnosis is reached. Even after diagnosis, children with RSD rarely have a clear understanding of the prevailing model of the nature of the disease. For example, 11-year-old Lacey tells her friends to ask her mother to explain RSD. However, even parents acknowledge the challenge to trying to explain the nature of RSD to others. Treatment efficacy is highly variable between patients. However, as occurred with Justin taking Neurontin, the patients interviewed rarely reported side effects. Such absence may be the result of the physician not having titrated to a sufficiently aggressive dose. This speaks to the importance of the physician closely monitoring the child and the importance of the provider being a physician well experienced in the disease. The case of Amanda is also noteworthy. She described how she experienced a consistent intimate temporal relationship between initiating transdermal clonidine treatment with symptom reduction and a return of symptoms with withdrawal of the medication on several occasions. Such withdrawal trials over a period of time might help the patient sort out a placebo effect from a true pharmacological effect on the disease. As was seen in the very candid comments of Sarah, psychosocial effects are dramatic. The symptoms of the disease reduces social contacts and isolates patients, so that the synergistic effects of the pain and the loss of opportunity for normal childhood and adolescent activity often results in despair and suicidal ideation. Because of these devastating physical and emotional effects, family dynamics are impacted and sibling relationships, in particular, can become strained. Support, understanding, and encouragement from family, friends, and school systems are therefore exceedingly important with RSD patients. RSD makes it impossible for these children to make plans or set goals for themselves on more than a day-to-day basis, often exacerbating the effects of their pain and frustrations. It cannot be stressed strongly enough that while the disease can be recalcitrant, remissions such as that which is being experienced by Lacey are not unique. Also, because of the hope provided by new medications and treatments, there is reason for optimism about the future. For complete guidelines for the diagnosis and management of RSD, please refer to the clinical practice guidelines available on the Internet in English, Spanish, and French, published by the Reflex Sympathetic Dystrophy Syndrome Association of America and by the International Research Foundation for RSD, CRPS.